Everyone, in this video we are going to discuss about the peptic ulcer, understanding, managing, preventing with the diet and lifestyle related one. Peptic ulcer are open sores that form on the lining of the stomach, esophagus, or the first part of the small intestine. It occurs mainly due to the bacterial infection and long usage of the NSAIDs. Treatment is required. It's not a neglecting one. Neglecting means leads to the some other complications. So, what is a peptic ulcer? A peptic ulcer is essentially an open sore that forms on the protective lining of the stomach. So, if it is formed in the protective lining of the stomach, call it as the gastric ulcer, or the upper part of the small intestine, known as the duodenum, call it as the duodenal ulcer. Based on the place where the ulcer is formed, they are naming as such gastric ulcer or duodenal ulcer. So, mainly damage from the digestive acids is happened here. There is two culprits behind this damage of the mucus layer. One is infection of the Helicobacter pylori, and another one is a long-term usage of the non-steroid anti-inflammatory drugs. This is the main reasons for getting this peptic ulcer. Main complications like bleeding, the perforation, and obstruction. We may observe in this persons. So, how to understand the underlying causes and adapting appropriate medical and lifestyle interventions is required for this condition. What is the key causes and risk factors for this is mainly Helicobacter pylori and NSAID is the main causes. So 70% of the population mainly they are suffering with the peptic ulcer due to this H. pylori infection. So H. pylori infection leads to peptic ulcer. How? It affects the stomach lining. How this H. pylori infection causes inflammation in the stomach lining. So it weakens the stomach lining. Automatically, it makes it vulnerable to the acid damage. And another one is the long-term NSAID use, ibuprofen, naproxen, aspirin. Continuous usage will affect the stomach lining and interferes with the body's natural defense mechanism against the stomach acids. Another underlying causes is also there. Not only these two, another causes is smoking and excessive alcohol intake. Both habits mainly they are increasing the stomach acid production, erode the protective stomach lining, and also impair the healing related function of this layer. Stress and unhealthy eating habits is also leads to the ulcers. It worsens symptom and hinder recovery by affecting overall digestive health and immune responses. Recognizing symptoms. What are the main symptoms we may observe in this peptic ulcer patients is burning epigastric pain in the upper abdomen, typically felt between the breastbone and the navel. This pain often occurs when stomach is empty. Between meals also they may suffer this, and in between midnight related times also temporarily relieved by eating certain foods or taking antacids. And another symptoms is digestive discomfort. Patient frequently they may experience bloating, indigestion, nausea, acid reflux, heartburn. A burning sensation raising into the chest can also common accompanying symptom due to increased acid irritation. And other alarming symptoms, it means severe cases, we may observe these kind of symptoms. So mainly vomiting blood means blood in the vomiting. It looks like appear red or like coffee grounds and passing black terry stools due to digested blood, unexplained weight loss, and severe sharp abdominal pain indicating a possible perforation. These are the main symptoms. Based on this, we may identify the person is suffering with peptic ulcer related one. Dietary management principles. So, while there is not a specific ulcer diet that works for everyone, adapting certain dietary principles can significantly help manage symptoms and promote healing. Mainly depends upon the person, other conditions, chronic condition, disease conditions like diabetes, obesity, or other person is not suffering with diabetes or obesity. Based on that, guidelines are differ, but common guidelines is eat small, frequent meals, have to favor soothing non-acidic foods related, avoid irritants related one, not too hot and too cold foods consumption is suggested. So these are the basic things they have to follow. Instead of three large meals, opt for 5 to 6 meals throughout the day. This helps to neutralize the stomach acid more consistently and prevents the stomach from becoming very full, which can trigger acid reflux. And another thing is the favored soothing non-acidic foods. They have to select the non-acidic foods, include cooked vegetables, lean protein, whole grains, and non-citrus fruits like that. These foods are typically low in fat and high in fiber also, aids digestion without causing irritation. Avoid the irritants which creates the irritation related thing. How to avoid that one? Mainly spicy foods, the fatty foods, caffeinated beverages, alcohol, chocolate, and acidic foods like citrus fruits and tomatoes. Have to avoid. A balanced plate of basic five food groups mainly provides a better recovery for this ulcer persons. So, before going to dietary one, medical treatment, we may check what type of medical treatment is required. Antibiotic therapy, mainly here, ulcer caused by H. pylori, a course of antibiotics is prescribed to eradicate the bacteria. This typically involves a combination of two or more antibiotics. It's almost 10 to 14 days course. With antibiotics, proton pump inhibitors are the class of medications that profoundly reduce stomach acid production. So they have to consume this proton pump inhibitors also. And acid reducers, proton pump inhibitors and H2 blockers mainly they have to consume. Avoidance of irritants. NSAIDs mainly they have to avoid when the person is suffering with the ulcers. They have to quit smoking, significantly limit alcohol consumption and other habits also. Lifestyle and diet modifications and the support is required for the peptic ulcer patients. So come again to the dietary management of the peptic ulcer person. So when we look into the dietary management, mainly the energy intake should be such as help the patient in achieving and maintaining an ideal body weight. So, an adequate energy intake is must to prevent the subsequent weight loss and spare the patients for healing of the ulcer. So, we have to calculate the energy requirements based on the patient anthropometry and their additional conditions. If the person is suffering with some other chronic condition, we have to take care of all these things. Or person is obese or something is there, we have to take care. But primary thing we have to consider is how to relieve the signs and symptoms of the condition. So related to that, we have to suggest a meal plan to this person. And proteins, is a form of wound, mainly if not healed on time, can get perforated and bleed. Adequate protein intake ensures synthesis of new tissue essential for the healing. Normal milk protein is valued for their buffering action, but it is supposed to provide temporary relief because the product of protein digestion reach the antrum and they stimulate the secretion of gastrin and gastric acid. So, milk neutralizes gastric acid only almost 20 to 60 minutes only. After that, the pH get adverse affects the healing rate of the ulcer because of high calcium content. Okay, so that's why have to include the lean protein or cottage cheese, egg, chicken, fish, adequate amount of beneficial protein for the persons. And according to RDA, generally we are going to provide 1 gram of protein per kg body weight. Apart from this, we have to suggest almost 15 grams, 10 to 15 grams per day above the RDA. We have to suggest that one. This is about the protein. Next, move on to the fats. These mainly fats digestion in the small intestine stimulates the enterogastrin, which inhibits gastric juice secretion. Okay, again I am telling fats mainly fats digestion in the small intestine stimulates enterogastrin, which inhibits the gastric juice secretion. So recently, polyunsaturated fatty acids such as linoleic eicosaphatonic acid, linoleic eicosaphatonic acid has been found to be effective against duodenal ulcer by inhibiting in vitro growth of H. pylori. So around 25 to 30 grams of visible fat may be incorporated in the daily dietaries. That is the thing. And carbohydrate should be provided around 55 to 65% of the daily intake. Emphasis should be laid on the consumption of both simple and complex carbohydrates, but in the soft, well-cooked form. Soluble fiber is more beneficial as compared to the insoluble fiber. So, have to include soluble fiber than the insoluble fiber. And the pH of the food is also we have to check. So, uh, acidic related thing almost have to avoid, and alcohol, cigarette smoking, gas formation related foods, cabbage, cauliflower, onion, peas, like that we have to avoid that foods. Gently here recommended foods is given. Softly cooked one we have to include here. And also steamed vegetables instead of raw vegetables we have to provide a steamed and a boiled and a smashed related one with lightly seasoned or without season. We have to provide that one. Lean proteins and non-citrus fruits like this, and also probiotics, yogurt, curd also we may include in the diet. Apart from this, hydration and the lifestyle practices is also important. It means they have to hydrate themselves. Regular water consumption is essential for treating this condition. Mainly, not only water, they may take herbal teas and herbal waters also. They have to avoid the carbonated beverages, coffee, acidic juices also. And I am again repeating one thing: too cold and too hot foods consumption is avoided in this peptic ulcer patients. So these are the main dietary guidelines they have to follow, and they have to follow the regular exercise and stress management related thing through the yoga, meditation. So it increases the digestive system health, and also reduces the stress of the person. Meal timings they have to follow, and avoid the large consumption. And another thing, try to eat at least 2 to 3 hours before laying down to the prevent acid reflux. ICM food guide pyramid and Indian foods for ulcer or diabetes. Mainly, we have to follow the food guide pyramid. So first, basically complex carbohydrates that releases glucose slowly, and crucial for the diabetes management. Provide fiber for gut health. If the person is suffering with the ulcer and diabetes, we may take care of these things. We may include brown rice, jawar, bajra, but softly cooked one have to provide. And vegetables and fruits provides mainly vitamins and minerals, fiber. Non-acidic option we have to choose here. Cooked leafy greens, tender greens, smashed one we have to include in the diet. And the proteins like that essential for tissue repair and satiety of the lean sources, and avoid overly spiced preparations. It irritates the stomach lining. That's why. And top layer is the smallest portion of the fats, oils, and sugars. Totally sugars and refined foods have to avoid or limit. Why? Because diabetes and ulcer condition is there. Instead of this required amount of polyunsaturated fatty acids, have to provide mainly mustard oil, olive oil, ghee. Have to provide them. Strictly have to avoid the sweets. So here I'm providing a sample menu for the person with obesity, diabetes, and also breakfast oats porridge with mashed banana and a teaspoon of flax seeds. Instead of flax seeds, may give a flaxseed powder. It's easy for the digestion. And why this one is fiber from the oats, mainly soluble fiber from the oats and the flax seeds, aids digestion and blood sugar control. Banana provides the soothing related one. Instead of skimmed milk, we may suggest a diluted coconut milk, diluted almond milk also provides the proteins, plant related protein and essential nutrients from that. Not only oats porridge, remaining thing also we may suggest. Remaining means like about idli dosa, but in the soft dosa, not a crispy and a hard related one, softly cooked, and also khichdi, pongal like that. We may add millets is also good, but soft cooked one have to provide. In the mid morning, papaya slices easy for digestion, rich in enzymes and non-acidic lunch. Brown rice, soft cooked one, and also steamed bottle gourd vegetable. Moong dal is also there. It balances all the protein and vegetable, and fiber is also there. Afternoon, this is not roasted chana, softly cooked smashed chana. We may add here carrot or beetroot cooked vegetables for better nutritional concept, and also a cup of herbal tea. It's a warm one, not too hot one. Dinner, two soft chapatis with minced chicken or tofu curry like that with the minimal oil, sorted spinach, and we may suggest a cup of curd like that. Must avoid coffee, carbonated drink, alcohol, all this. Okay, what is the takeaways of this? Presentation is integrated approach is required. Means peptic ulcer mainly it occurs through the infection of the bacteria and also usage of the NSA ID. So treatment mainly they have to practice dietary and also lifestyle practices, and they have to take care of the medicine which they are suggested. They have to continue that medicine how many days doctor they suggested, and the dietary wisdom. Avoid the dietary irritants. Mainly, they have to balance the intake, soothing nutrient-rich Indian foods guided by the principles similar to the ICMR food guide pyramid. Next, holistic health. Managing coexisting conditions like obesity and diabetes is crucial, as these can complicate ulcer healing. So, and consistency is the key. Adapting practices like eating small, frequent meals, staying hydrated, and avoiding late night eating are crucial for preventing acid spike. Always consult a healthcare provider. Thank you.